This video is going to show universal draping, which is another option for a flat surface draping, especially when our incision is larger than will be accommodated by a laparotomy sheet. Because this is basically a laparotomy sheet cut into 4 pieces. So we have a bottom or a foot, a head or a top, and then 2 sides. And then based on where we place those sheets will determine how big or how small the fenestration is. So we use this very commonly when the incision is going to be bedside to bedside or from one side of the patient to the other. So if that was the case, such as if we were squaring off to do, let's say, an abdominoplasty, we are going to place our square off towels a little bit different. So you actually take and drape the towel back over your hands so that your hands are protected or cuffed, so that we can take and shove them underneath the patient and so that we're not going to get contaminated as we do that. So we're just going to drape it back over our hands and then tuck it underneath our patient and then make sure that you pull back out so you're not going to touch anything that's unsterile. We then place the top and the bottom towels. A lot of times if you're draping with somebody else, they will go ahead and place the ones that are on the other side. So you may be handing square off towels to another person that's on the other side. And then they'll take and they'll place their towels the same way that we did, making sure that they cuff their hands. And then we kind of just connect the dots. So because it is a larger area, you're probably going to be using, between 6 and 8 square off towels, just depending on how large of an area is going to be squared off. But we just want to make sure anything that's unsterile is covered and that all of the towels are overlapping with each other. Okay, then on your sheets, it's going to tell you which it is, if it's a head or if it's a foot or if it's a side. Okay, so this one you'll see where it says foot, and it has an arrow of towards the incision. So we want the adhesive to be closest to the incision. So you want to hold it so that the fold is down. You're going to split it in half with the person that you're draping with. Oftentimes there's going to be arrows on the inside. We're going to hold it high enough that we can pull this paper off of the adhesive, and then we're going to get rid of that to an unsterile person. And then we're going to stick down our drape onto the patient, and then we open it up, we cuff our hand, and it's just like the bottom of a laparotomy sheet. So we go ahead and open that up, and then allow the rest of that to fall. We then are going to place our head. So again, you'll see on here where it says that this is the head, and we want the arrow towards the incision. So this time, I want to position it this way so that the adhesive is closest to where I'm going to make the incision. We split it in half. Again, we hold it high enough that we can pull this paper off of the adhesive. We're going to take and stick that down, and then we would open it just like the head of a laparotomy sheet. Okay, so again, we're going to cup our hand, come up, and then we would wait for our anesthesia provider to go ahead and attach that to the IV poles. Next, we're going to do our 2 sides. So the sides are interchangeable. There's not a right and a left. So if you are draping with somebody else, you do want to get your side sheet ready and then hand it over to the other person that you're draping with. So you can hand them a side sheet so that they can go ahead and get ready. You're going to pull off the paper off the outside of the side sheet. You're going to open it up like a book. And then you either let it unfold or you can stick it down. It doesn't really make any difference which one you do first. But because we were squaring off for bedside to bedside, you want to make sure that that sheet is all the way down to the sides of the patient. So that way then the incision can be carried down. And then depending on which layer is exposed, you're just going to pull off the paper to expose the adhesive and then open that up. But make sure, because this portion of the drape has been hanging down, that you don't allow any of it to come back up and contaminate. So you need to kind of guide it so that it opens up without having that portion coming back up and contaminating. And then you can see that this fenestration is much larger than would be accommodated by, say, a laparotomy sheet or even a transverse laparotomy sheet, and would allow us to make our incision from one bedside to the other. So this is universal draping. We did the 6 to 8 square off towels, the bottom, the top, and then the 2 sides. Now there are some surgeons who may put their sides on prior to their bottom and their top, just depending on their preference, but this is very commonly the method in which we apply these sheets.